Welcome to the Tell Me More Now channel. 7 strategies to manage diabetes and avoid complications. The disease of diabetes is not just about a series of blood sugar numbers. The high blood sugar affects several organs and blood vessels of the body. For example, unchecked diabetes can cause blindness, heart disease, stroke, and kidney failure. For this reason, you'll want to learn all you can about your diabetes and plan strategies so that the complications can never happen. Here are some strategies to keep your diabetes in check. Please note that the contents of this video is for informational purposes only. Do not consider it as medical advice. 1. Make it a habit to get at least 30 minutes of exercise per day. Exercise, especially aerobic exercise in which you get your heart rate going, has several beneficial effects on diabetes. The act of exercising burns calories and sugar, so your blood sugars go down. Lowered blood sugars mean that diabetes has less of an impact on your health. If exercise is something foreign to you, start by doing some walking outside or in a mall if the weather is inclement. Work your way up to more vigorous forms of exercise, under your doctor's advice, especially if you begin to lose weight and exercise comes easier for you. 2. See an eye doctor once a year. Diabetes that is not well managed can cause a condition known as diabetic retinopathy. With diabetic retinopathy, the small vessels of the retina and back of the eye rupture and bleed, causing poor vision that tends to be permanent. If diabetic retinopathy is detected early enough, there are things that you and your doctor can do that can reverse the pattern of the disease so as to spare your vision. 3. Have regular contact with a nutritionist. A nutritionist can help you keep your diet fresh and can guide you on the proper things to eat while diabetic. You can work together to create a meal plan that has the right amounts of carbohydrates, protein, and fats with a calorie count that doesn't cause weight gain. Your blood sugar numbers will be better overall and you won't suffer as much of the complications of diabetes. 4. Concentrate on losing weight if you are overweight. Being overweight contributes to the worsening of diabetes as well as to other medical conditions. If you are diabetic and overweight, you might try a meal plan that cuts out enough calories to effect a slow, yet significant weight loss. Your blood sugar numbers will be in a better range and the adverse effects of high blood sugar will be eliminated. Losing weight can be hard, but it is truly one of the best ways to normalize your diabetic metabolism. 5. Limit your raw sugar intake. There is no reason to fill your body with empty sugar calories, as it will only serve to drive up your blood sugar values. Eating sugar can cause spikes in blood sugar so that complications can arise. Steadily flooding the kidneys with glucose can over time lead to kidney disease and kidney failure. 6. Watch your fat intake. Diabetes often goes right along with having high cholesterol and triglyceride counts. These fats you consume in your diet along with high blood sugar can eventually clog your arteries, causing heart attacks and strokes. By watching your fat intake along with your intake of sugar, you can doubly prevent these complications. There are plenty of low-fat alternatives to things like cookies, pastries, and even salad oils, so that you have other choices of what you are putting into your body. The combination of low fat and low raw sugar intake can drastically influence the kinds of complications of diabetes you get, or maybe never get at all. 7. Take care of your feet. If you have diabetes, you may experience issues with your legs and feet. Which are the disease's 2 usual areas for complications to appear? Diabetes increases your risk of ulcers, calluses, corns, blisters, and bunions. High blood sugar means even small injuries and changes can turn into reasons for possibly debilitating infections. However, you can maintain your feet health by keeping your feet clean, getting regular foot examinations, and engaging in certain low-impact exercises to improve blood circulation. Manage your treatment and be mindful of your care. With a combination of healthy lifestyle choices, regular blood sugar checks and medical management, diabetes can be managed and complications can be avoided. This is a chronic disease, but unlike cancer or other serious illnesses, diabetes can be controlled, and as long as you remain vigilant and mindful of all the recommendations to manage blood sugar and make healthy choices in diet and exercise, you can live a long and healthy life. Subscribe to be notified of new videos on self-help, health, and wellness.